Hello, and thank you for joining us. Today, we're going to talk about senior living and how to find the best retirement community for your lifestyle. Here with me, I have one of our friends at Chateau at Valley Center, and I'm going to ask her to introduce herself.
Hi, and thank you for having me. My name is Molly Cole, and I'm the Chief Marketing Officer and Chief Resident Experience Officer for Chateau Retirement Communities.
Wonderful. Thank you so much for being here, Molly. So let's start with the first question. What are the various options for senior living, and how are they different?
So there is the option to stay at home, which is potentially an option for those that plan ahead and prepare for the unexpected, which is what normally is the cause of a lot of moves, whether it's a death of a spouse and loneliness, whether it's a physical issue that needs more help. So if they can stay at home, that would be great. But odds are there's going to be needing some remodeling done, such as grab bars. Is it one-story roofing? Also, is there family that can move in, family that can stop by and help? So there's a lot of variables to staying at home. Not to say it can't be done, but there will take a lot of planning. And normally it's just not on the potential residents' part, but it's also on their families and how they plan to help themselves. Bringing in home health is also an option. If staying at home is not the safest or best option, then there are communities such as independent, assisted, and memory care communities. There's also adult family homes. Adult family homes tend to be more for those that are more higher acuity and need a much smaller setting than, say, an independent and assisted living community. You're going to hear independent assisted living and then a CCRC, which stands for Continuing Care Retirement Community. And really all that means in a nutshell is that they offer multiple levels of care.
Next, can you talk about some of the important financial considerations to make?
Yes, the financial considerations are one of the most important things. When I'm working with families, I need to know, one, what the care levels are there or may be in the future, as well as the financial, because they can all be very different. Medicare at this time does not cover assisted living. So the financial burden is on that resident or the families. It's called private pay. So they pay for the rent and their assisted living. Medicaid, which is for lower income, will cover some people who qualify for assisted living. Also, what can pay for assisted living will be long-term care insurance if the resident has been paying into that over time. That is something to check into. They are all a little bit different on when they start coming into play. Normally, there has to be assisted living. They do not cover independent living. And there is also the VA aid and attendance for those residents and or spouses for those that may qualify. Now, again, there is a financial qualification piece to the VA aid and assistance. But I would encourage anyone who either served or had a spouse who served for even one day during a time of war, they may be able to qualify for that VA aid attendance. So those are some ways that where you might get some help paying for at least assisted living services.
Great. So, how might someone's healthcare plan affect their decision?
Healthcare plans would only affect their decision on whether or not the doctor in the hospital that their healthcare plan covers them under is near their community. Within a community, it doesn't normally matter because most communities are not subject to healthcare programs because there is no financial coverage within a community in and of itself. So the important healthcare programs would be, are they nearby? Are they close?
What about when one spouse has health needs that change and they require a different level of care? Or if one of them passes away? How easy is it to transition those accommodations?
That's a very difficult question because many times, as two people, as a couple, or a partnership, whatever that may look like, you need to find out, again, the financials. What does it look like when they move in together? What does it look like when one is no longer there? 9 times out of 10, when couples move in, which we tend to get more couples than singles these days, is because one of them is the caregiver for another. And normally it's the caregiver that really needs to make the move because they're exhausted. The one that's being taken care of tends to be the one that's most hesitant, is what we found. It's really important that couples start this conversation before there is a need. One of the bonuses, or one of the many bonuses of that, is it gives the caregiver the rest. It gives the one who needs the care even better care. It allows the spouse to become the spouse again and not the caregiver. What if one of those members of that couple passes away? The surviving couple, spouse, partner, whatever it might be, already has a built-in support group. They've already made friends. They already have activities, and people are there to go with them along this journey and then catch them when they need that support. So it really helps both partners in that coupledom if they make the move together in so many ways. Find the communities that you love, the top three, because something might happen unexpectedly and that decision may not be able to be made by you at that time. So let your loved ones, let your power of attorneys, let your best friends know if something were to happen to me and I end up in a hospital and they say, you can't go, Paul, have them know what your top choices were so that they can help get you to a place that they know that you have chosen, so that you'll know that that's the place that you've chosen. So that would be my advice. Be proactive before the need happens.
So, taking all of these things into consideration, what are the most important questions people should ask when they're making these decisions?
The most important questions to me will always involve financial questions and healthcare questions. At the end of the day, those are the things that actually matter versus amenities. And number one being healthcare. So if you have a healthcare issue, you want to make sure that that community can handle that healthcare issue, as well as any others that might be hereditary. If you're a couple, can you live together? If one of the partner's needs progress differently than the other, can we stay in an apartment together? If not, what does that look like? Does my partner have to move? And if they do have to move, whose choice is it? Is it theirs? Is it the community's? Is it a mixture of both? And is there an option at all for us to stay together? And what does that look like? Do I have to bring in my own care? Do I have to pay extra? All communities will be very, very different on how they handle their assisted living. So be very, very careful on asking those questions. Not only do I have to move, when do I have to move, and what does that move look like? How will you accommodate, and who makes the decision? Because sometimes what happens is there's a certain number of apartments in independent living, which is a higher number, then that number drops. In assisted living, then it drops. In skilled nursing, then it drops again in memory care. So another question to ask is, will you have room for me? Well, it's time. And if not, what happens then? So in terms of care, those are my important questions. In terms of finances, the best questions to ask is, what is the financial commitment here? What is the community fee, also known as a move-in fee? It's the same thing, but different communities will have different amounts. So find out what that community fee is and what it looks like. A CCRC will almost always have what's called an entry fee. And an entry fee is a large lump sum that you pay for a particular apartment. And the cost will normally range depending on location in the building and size. It can be from a studio, a 1-bedroom, a 2-bedroom, maybe even a 3. If one has a view and one doesn't, that will affect the price range, even though it's the same type of apartment. Even with that large entry fee, they will almost always still have a monthly rental fee attached to that. Also, care is almost always an added cost. care will be different from rent because you can move into any apartment as an independent and hopefully they can provide that same care within your apartment. And then you just add the care fees onto that. So, but ask that question. Can I receive care in the privacy of my apartment? And if so, what are your levels of care looks like? And how is that level of care determined? It's determined by a nursing assessment. And that's an also great question to ask. Do you have on-site nurses, on-call nurses? Or do you have one nurse that goes to different communities? Or do you always have an on-site nurse? Because that will also make a difference sometimes financially, because those with nurses on site will have to charge more for care because nurses are more expensive than caregivers. But I can guarantee you, if you have nurses there 7 days a week, your care level is most likely going to be better because you have nursing oversight and nurses are worth every dime.
And finally, is there anything we didn't cover that you think people should know about that you want to include?
I think what people should know is you can go visit communities whenever you want. On your first initial tour, I would suggest making an appointment so that that community sales director can have some one-on-one time with you and really answer all of your questions personally. And then I suggest dropping by. Drop by, see how it happens when they're not expecting. Ask to join for meals, whether it's breakfast, lunch, or dinner. Ask if you can I join some of your activities? Can I come to your happy hours? Can I see some of the events? And sit with the residents, sit in it. Find out, can I have a guest stay? Can I see how a week might be? Ask those questions, really engage. Don't base your decision off of one meeting. This is going to be your home one day. Bring your loved ones by. Try the food. Talk to residents. Talk to more staff. Walk through the buildings. Engage like you might as a resident, because your whole goal is to become one. So experience it. The goal for all of us in senior living is not to sell a particular community. It's to help those make the right decision come out. It's all about the resident, and that's how it should be.